Kenya's population is merely 0.69% of the world population, but contributes at least slightly over 5% of death directly or indirectly linked to antimicrobial resistance. This is according to the World Health Organization report of 2019. Based on this data, Red Cross Society, working in consortium with other partners, are currently running a project dubbed Rocket with a focus on Uasin Gishu and Kajiado counties, as Dr. Paul Olale explains.
This is a project that KRCS is actually implementing at the community in 2 counties within the country.
But what is antimicrobial resistance, otherwise known as AMR?
Is basically the state of our bodies being unable to respond to drugs whenever we fall sick, to drugs that initially used to be effective on us. If you look at the global statistics, according to the publications by WHO, it's actually projected that if nothing is done completely, we're basically going to be having up to a tune of 10 million deaths associated to AMR.
Antibiotics are among the most abused drugs. Abuse may come in form of underdose or overdose, and quite often without prescription.
But as much as our project is really focused on the entire antimicrobial family, but much focus and much strength is actually given to antibiotics, simply because you realize that these are the drugs that you won't go a kilometer within a community without finding a chemist that had just dispensed such drugs.
Dr. Olale says the problem stems from a culture of self-medicating. Quite often, Kenyans will casually walk into pharmacies and pick the antibiotic drug of their choice.
We are fond of self-medicating, that is one. Whenever we fall ill, including mild illnesses such as flu, we'll always want to run to the chemists of our local pharmaceutical outlets. Likelihood that they'll have now adopted or had a way of evading the effect of that drug when you take it is very high. And when that happens, resistance will always be there and that drug will never help you.
According to the doctor, continued use of antibiotics weighs heavily on vital body organs like the liver.
And our main organs, the kidneys and the liver, which is basically designated of toxin elimination and all that, actually has to strain in the event that you overload your system with these drugs to be able to clear these particular residues.
Most Kenyans admit they have self-medicated and they have reasons, but oblivious of the health implications.
Kuniandikia madawa kaniambia cost inakuja 920. Nikalipa. Hiyo madawa kuangalia muda yenye nafaa nisimese juu hakuna injection alinipatia. Nikameza hiyo madawa for 1 week. After the day nilimalizia hiyo madawa, hiyo siku nilisikia kucollapse. Nilikuwa nasikia hata ni kama ninaenda.
Nishaenda mara mingi sana kwa chemist, unamwambia unasikia pengine unaumwa na pahari, yeye anakutorea dawa tu anakupea tu. Na unameza tu, ingine ifanyi kazi, ingine ukienda saa hizo ukipima unaambia hiyo dawa hata sio ya hiyo.
Sana nikiona hata nimeshikwa na homa natumia antibiotic, hata siendange hospitali. Ukipiga hesabu ya kwenda hospitali upige laini, daktari anakupima kuambia shida, kuandikia madawa upone. So mimi naenda tu chemist.
These particular practices with many others, such as sometimes we follow the right procedure, get to the hospital, have prescription done for us. We go into the pharmacy, get drugs dispensed. We go home, take the drugs. For example, you're given a dosage of let's say 10 days, all right? Or given a dosage of 5 days. You go take the drugs for 3 days, you start feeling better, and then you store the others. Yeah, that basically in the long run is also a factor that contributes to resistance.
Pharmacies that prioritize profit-making over public health have compounded this problem, not to mention weak regulations.
Hauko sure na ugonjwa, na pia juu yako biashara. Ala sasa kitu kingine utapata yeye pia ana experience ya kuconfirm ako 100% ni nini anakutibu.
However, the abuse of antimicrobials is not limited to direct consumption of drugs alone. Alice Njari is the Uasin Gishu and Nandi Counties Kenya Red Cross Society coordinator and says members of the public lack information about AMR.
I think the community has been ignorant to the fact that you can be resistant to a drug. And the thing is that The AMR project has now will now enlighten them so that now they get to understand the importance of getting prescriptions from the doctor before taking any antibiotic. And the beauty about the project is that the community health volunteers, together with the Kenya Red Cross volunteers and the universities together, we are all working towards trying to educate the community and enlighten them the importance of them actually adhering to the AMR.
Timothy Simwa, K24 TV.